Hybrid pupil dilation. Preoperative plus intraoperative. Using tropicamide eye drop and very low concentration of epinephrine in BSS. Pupil dilation is very important in cataract surgery. We use two types of drugs, parasympatholytic to relax the iris sphincter muscle and sympathomimetic to stimulate dilator muscle of the iris. Preoperatively, 1% tropicamide and 2.5 or 10% phenylephrine eye drops are used 3 times each, 5 to 15 minutes apart. Last drop 30 minutes before surgery. Intraoperatively, 0.5 ml of 1:1000 epinephrine, 0.5 mg, is added in 500 ml of BSS. This is 0.0001% epinephrine in BSS solution that we use during the surgery to maintain good pupil dilation. This technique has been used by most hospitals in Thailand for decades. There are some problems related to topical dilating drops. Ocular irritation from multiple drops causing stinging. Superficial punctate keratitis. Systemic side effect, from phenylephrine, causing hypertension. Cardiac arrhythmia. Myocardial infarction. There are some reports using intracameral mydriatics in cataract surgery, such as AP sugarcane solution, made from epinephrine 0.025% and lidocaine 0.75% in BSS+. Lundberg and Bindig solution, made from cyclopenthalate 0.1%, phenylephrine 1.5%, and lidocaine 1%. Epinephrine hydrochloride 0.001%. Lidocaine 1% with or without phenylephrine 1.5%. Topical dilating drops can be minimized using hybrid pupil dilation technique. Hybrid means combining preoperative topical dilating drop with intracameral epinephrine solution during the surgery. Hybrid pupil dilation technique starts with 1 drop of 1% tropicamide eye drop, 30 minutes before surgery, to relax iris sphincter muscle. Adding 0.5 ml of 1:1000 epinephrine, 0.5 mg, in 500 ml of BSS, to make 0.0001% epinephrine in BSS. Irrigate anterior chamber with epinephrine solution in BSS using IA tip for 30 seconds, to stimulate iris dilator muscle. Inject viscoelastic after irrigation, to maximize access of solution to iris tissue. The pupil in this case was semi-dilated after 1 drop of 1% tropicamide eye drop 30 minutes before surgery. The surgery started with side port incision using 21 gauge needle. Making the main incision with the keratome, using quick in and out maneuver to avoid flat chamber since there was no viscoelastics in the anterior chamber. IA with 0.0001% epinephrine in BSS for 30 seconds. The pupil was fully dilated after the irrigation. Viscoelastics was injected after the irrigation. This is another case of hybrid pupil dilation technique. After 1 drop of 1% tropicamide eye drop 30 minutes before surgery, the pupil was semi-dilated but bigger than the previous case. After intracameral irrigation with 0.0001% epinephrine in BSS for 30 seconds, the pupil was fully dilated. The pupil was well dilated till the end of the surgery. Comparing pupil size pre- and post-operatively, hybrid pupil dilation technique worked well. The patients felt more comfortable because we use only one dilating drop pre-operatively and also because of less ocular surface problems. In conclusions, 1 drop of 1% tropicamide solution at 30 minutes before surgery plus intracameral irrigation with very low concentration of epinephrine in BSS for 30 seconds is a safe and effective alternative for pupil dilation for cataract surgery. Also use 0.0001% epinephrine in BSS for phaco and IA to maintain good mydriasis. This technique works well with floppy iris syndrome, IFIS. With special thanks to all staffs at Mydriatic Hospital and Eye Institute for supporting my work. Thank you very much for your kind attention.